Garcia here, one of the sports and cartilage surgeons. Today we're going to do a video testimonial. This is a patient, young, under 30 years old, had a majority of the meniscus removed, also a pretty tall guy, almost 6'6". And he comes in and he's got a lot of pain on the inside of his knee. It turns out he's got what we call medial meniscal deficiency. And so by having enough meniscus removed, some patients develop symptoms. You've seen this with Lonzo Ball and other recent athletes. And these patients are difficult to treat because there's really not much options. They can't get a knee replacement. They're not bad enough yet with cartilage damage. And so a meniscus transplant is an excellent an excellent surgery for this patient. And you can see he did quite well. We found a good match for him given his size. And he had a good result and he's happy with it. So enjoy the testimonial.
When I was in high school, I had about, I think, quite a bit of my meniscus removed, and over the last 10 years, it's been a bit of a declining kind of matter and really limiting a lot of the things I like to do. Outside, running, golfing, hiking, time in the mountains, and it was in pretty rough shape when I came and saw Dr. Garcia, and it just really, turned the whole thing around. I'm looking really optimistic.
Tell me about your symptoms beforehand. What was your knee feeling like?
Yeah, so really limiting. It was really hard to spend more than, maybe an hour or two on it at a time. Really hard to just kind of get around in general with lots of pain, and especially as someone who was at that point not even 30 yet, very very concerning. And then especially since I went to see somebody else first, and it was not the brightest outlook. So really inspiring. And before that, I wasn't quite sure what was even possible, and then just sort of looking at people who had similar experiences, I'm glad I stumbled upon Dr. Garcia's page, and it was like night and day, and left the office feeling about 1,000 times better than I did entering.
Did you feel informed about the surgery before you did it?
Yeah, I did, and I feel like his page was really informative. I watched, I think one of the entire procedures, so I was very aware of what was going to happen, and they were super willing to answer any questions that I had. Yeah. So the recovery, it was about 6 weeks on crutches, which was pretty tough initially, but after that it was just sort of very very linear progression, and not too much pain. I would just say the getting around on crutches is probably the worst part, and then first couple of days or so, but after that it was got a lot better pretty quickly.
How has this changed your life? What have you do differently now than you weren't able to do before?
I think it's just really getting me back on track, because especially prior to the surgery, being inactive, put on a fair amount of weight before that, and I really feel like I'm getting back to my old self and all the stuff I loved to do beforehand. So it's very very optimistic. Are
you happy you did this surgery?
1,000%, yeah.
And if you had a friend, someone with the same injury, same issue, would you recommend the surgery to them?
100%, yeah.
Activities you're doing now?
So I'm back to some light running, hiking, golfing, and I don't feel limited whatsoever, so.
How tall are you?
6'6".
There you go. See, meniscus transplant work at 6'6". There you go.